Tonight, when your alarm reads 2:47 a.m. and you are already on your second trip to the bathroom, I want you to remember one thing. That is not your bladder failing you. That is your body trying to tell you something. And the message is not what you have been led to believe. I am Dr. William Lee. I've spent 15 years in clinical practice watching patients come in exhausted, embarrassed, and completely convinced they were dealing with a bladder disease, a serious structural problem, something that required medication, possibly surgery, definitely a specialist. And most of the time, the real cause came down to one thing. Nobody had ever taught them how to drink water correctly. Not the amount, not the brand, the timing, the distribution, the invisible downstream effects that most people never connect to their sleep. Here is the statistic that stopped me cold the first time I encountered it. Research out of Japan, one of the most cited hydration and nighttime urination studies in the last decade, found that targeted changes to the timing of fluid intake alone reduced nighttime bathroom trips by 40% in adults over 65. 40%. No prescription, no procedure, no expensive intervention, just a smarter, more strategic relationship with water. Before we go further, subscribe and hit like. Dr. Ethan Vale is working toward 1,000 subscribers, and you can help move that number right now because today I'm going to walk you through 3 hydration habits that could give you your nights back, and I'm going to rank them in order from foundational to the one that changes everything. By the time we reach number 1, you are going to understand something about your own body that most doctors never take the time to explain. Do not skip ahead. What's sitting about to show you at number 1 is the opposite of what you have been told your entire life. Here is what nobody tells you clearly enough. A standard clinic appointment is not designed to solve this problem. Nocturia, that is the clinical term for waking up repeatedly at night to urinate, gets maybe 3 minutes of airtime at a typical visit. The doctor checks for infection, perhaps orders a prostate screen or a bladder ultrasound, and if nothing obvious shows up, you leave with a shrug and maybe a referral. The system is built around finding pathology. It is not built around teaching you the physiology of how your own body handles fluid across a 24-hour day. That is why this channel exists. Before the 3 habits make sense, you need to understand what your kidneys are actually doing while you sleep. Think of your kidneys like a water treatment plant that runs 2 different shifts. The day shift from roughly early morning through mid-afternoon is high output. Your kidneys are filtering your blood aggressively, producing urine at a rapid pace, keeping your fluid balance tight as you move, eat, sweat, and go about your day. They are designed to run hard during this window. But as the sun goes down and your body begins its transition towards sleep, something remarkable happens. A hormone called vasopressin, also called antidiuretic hormone, which simply means the hormone that tells your kidneys to slow down urine production, rises steadily in your bloodstream. It is your body's internal signal that the night shift is beginning. The kidneys receive the message, pull back on output, and concentrate whatever urine is still being made. Your bladder gets a chance to rest. Under ideal conditions, most adults can sleep 6 or 7 hours without needing to wake up at all. That is the design. That is what your body is trying to do every single night. The problem is that we keep interrupting it. When you drink a significant volume of fluid in the 2 to 3 hours before you go to bed, you overwhelm the vasopressin signal. Your kidneys keep filtering as though it is still afternoon. Your bladder fills not slowly and quietly, but steadily and relentlessly. And at some point, usually between 90 minutes and 3 hours into sleep, the urge to void wakes you up. You go, you come back, you fall asleep, and then it happens again. Here is what makes this worse with age. After 60, vasopressin secretion begins to decline measurably. Research from a major European university found that adults over 65 produce up to 30% less vasopressin during the night than adults in their 30s and 40s, which means the same evening glass of water that your body handled effortlessly at 42 now bypasses the hormonal break entirely. Your kidneys are getting a weaker stop signal, so they keep going. This is not a disease, this is biology. But it is biology you can work with if you know the mechanism. And now you do. Let me destroy a myth that is causing real harm to real people. The myth is this. If you're getting up at night to urinate, You should simply drink less water overall. Restrict your intake. Stay a little dehydrated. Problem solved. Here is why that is wrong. Chronic mild dehydration is one of the most dangerous things an aging adult can do. It thickens the blood, strains the kidneys, raises the risk of urinary tract infections because concentrated urine is more irritating to the bladder wall, not less. And it accelerates cognitive decline. So simply cutting your water is not the answer. The research does not support it, and 15 years of clinical practice absolutely do not support it. The real issue is not volume. It is distribution across the day. Where your fluid goes and when determines almost everything about how your body handles it overnight. The goal is not to drink less water. It is to drink the right amount at the right time. That distinction matters enormously. And because one path leads to better sleep and the other leads to kidney stones and fatigue on top of an already exhausted body, let us get into the 3 habits, starting with number 3, which surprises almost every patient who comes through my door for the first time. Number 3, the evening fluid cutoff. You are winding down after dinner, the television is on, you have a glass of water on the table, maybe some herbal tea, maybe a small juice. This feels healthy. It feels responsible. After all, you've been told your whole life to stay hydrated. But look at what time it is. If you are planning to be in bed by 10 o'clock and you are still drinking at 8, your kidneys have less than 2 hours to process that fluid before vasoprene is supposed to take over. And as we just established, for most adults over 60, that vasoprene system is already running at reduced capacity. A clinical study published in the Journal of Urology examined over 400 adults with documented nighttime urination problems. Those who implemented a structured fluid cutoff 2 to 3 hours before their target bedtime reduced their average nighttime bathroom trips from nearly 3 per night down to under 2, a 43% improvement. A separate Dutch study confirmed the pattern, showing that evening fluid restriction reduced nighttime urine output volume by 38% in adults over 60. The implementation is simple. Take your target bedtime, count back 2.5 hours. That is your cutoff. After that point, no beverages. If you are thirsty, take a small sip. We are talking 4 to 6 ounces, but no full glasses, no cups of tea, no bedtime water bottle on the nightstand. One more thing. If your evening beverage contains caffeine or alcohol, eliminate it entirely, regardless of volume. Both caffeine and alcohol directly suppress vasopressin function. They do not just add fluid. They actively disable the hormonal mechanism that was supposed to protect your sleep. A single evening cocktail or a late cup of tea can undo your cutoff almost entirely. This is habit 3. It is foundational, but it only works if you have done the other 2 things correctly, because those 2 habits determine how much fluid is still in your system by the time the cutoff arrives. Which brings us to number 2. And number 2 is where most people have the biggest gap. Number 2, front-loaded hydration. Here's the pattern I see constantly in clinical intake forms. A patient wakes up, maybe has coffee, does not drink much through the morning because life is busy. Lunch comes with a glass of something. Mid-afternoon, they start to feel parched, so they finally start drinking. And by the time evening arrives, they are catching up. 1 glass, another a glass, with dinner, some water while watching television, and then they wonder why they are up at 2 in the morning. This pattern is physiologically backwards, completely inverted from what your body needs. Your kidneys process fluid most efficiently during the peak hours of your physical and hormonal activity, roughly 7 in the morning through early afternoon. During this window, your aldosterone levels, your renal blood flow, and your sodium regulation system are all calibrated for high volume throughput. Give your kidneys water at 9 in the morning and they will process it efficiently, distribute it to your tissues, and clear the excess through normal daytime urination. Give those same kidneys the same glass of water at 8 in the evening and it lands in a system that is winding down, slowing output, and has nowhere productive to put it except into your bladder as you try to sleep. A clinical trial from South Korea divided 320 patients with nighttime urination problems into 2 groups. One group drank water without any timing guidance. The other group was instructed to consume 70% of their daily fluid intake before 2 in the afternoon. After 8 weeks, the front-loaded group reported a 47% reduction in nighttime bathroom trips. The control group improved by 9%. Same amount of water, completely different outcome based on when it was consumed. A separate study from Japan confirmed that front-loaded hydration also reduced the actual volume of urine produced overnight by 35% in men between 55 and 75. The kidneys had already done the work. There was simply less left to process at night. How do you apply this? Starting tomorrow, before you open your phone, before the coffee, before anything else, drink a full 8 ounces of water. Then aim for 2 more glasses before noon. Set a phone alert at 11 if that helps. By the time 2 o'clock arrives, you should have consumed the majority of your fluid for the day. The afternoon becomes a taper. Evening becomes a sip here and there before the cutoff closes. This costs nothing, requires no prescription, and when you combine it with the evening cutoff from habit 3, you create something the research calls a synergistic effect. The whole is significantly greater than the sum of the parts. But here is what almost nobody talks about. Here is what I consider the most important discovery in managing nighttime urination in the last decade. Because number 1 is not about when you drink. It is not even about how much you drink. It is about something that is happening inside your body, silently, invisibly, every afternoon, or that you have almost certainly never connected to your sleep. Number 1, sodium and fluid redistribution from your legs. I want you to lean in for this one. For many adults, particularly after 60, the primary driver of nighttime urination is not a bladder problem at all. It is a fluid redistribution problem. Here is the mechanism. Throughout the day, if your diet contains moderate to high amounts of sodium, and the average person's absolutely does, fluid accumulates in the soft tissue of your lower body, your legs, your ankles. It pools there quietly, held in place by gravity during all those hours of sitting or standing. You may notice mild puffiness in the evening. You may not notice anything at all, but the fluid is there. Then you lie down flat. Gravity no longer holds the fluid in your legs. It redistributes upward. It re-enters your circulation. It travels to your kidneys, and your kidneys, doing exactly what they are designed to do, filter it directly into your bladder. This is why so many people feel perfectly comfortable going to bed, drift off without any urgency, and then find themselves wide awake, needing the bathroom 60 to 90 minutes later. The bladder was not full when they fell asleep. It filled after they lay down, because their body was quietly draining their legs. This mechanism has a name, nocturnal polyuria, driven by positional fluid redistribution. And a landmark study published in the Journal of Urology found that simply reducing daily sodium intake from roughly 10.5 grams to 8 grams, a modest reduction, produced a 25% decrease in nighttime bathroom trips. Participants went from an average of 2.3 nightly voids down to 1.7. No medication, just salt. A follow-up from the same research group found that combining salt reduction with afternoon leg elevation, lying down with your legs raised for 30 to 45 minutes before dinner, produced a combined 52% reduction in nocturnal urine volume. That is not a small effect. That is a life-changing effect for a zero-cost intervention. Think about what that mechanism means. The leg elevation is not passive rest. You are actively redirecting that pulled fluid back into your circulation while you are still awake and upright. So your kidneys process it during the afternoon while you are sitting in the living room before dinner, not at 3 o'clock in the morning when you are supposed to be asleep. When you layer this strategy on top of the evening cutoff and the front-loaded hydration, the 3 habits stop functioning as separate interventions and start functioning as one unified system. Front-loading means your kidneys do their heavy work early. The sodium reduction means less fluid accumulates in your legs to begin with. The afternoon elevation drains what little does accumulate during daylight hours. And the evening cutoff sends your kidneys into the night with almost nothing left to do. This is what I mean when I say number 1 changes everything. Let me tell you about Clara. Clara was 74 when she first came to see me. Sharp woman, a retired secondary school headmistress, the kind of person who had run a department of 60 people for 20 years and was not accustomed to problems she could not solve. But she'd been waking up 4 to 5 times every night for nearly 3 years. She had tried 2 different medications, she had done pelvic floor rehabilitation, she had eliminated coffee entirely, and something she described as a genuine sacrifice. Nothing had given her more than a few good nights before the problem came back. When she sat down across from me, the first thing I did was not order a scan. I asked her to walk me through a typical Tuesday, what she drank, when she drank it, what she ate, and where she spent her afternoon. The picture that emerged was almost textbook. Clara was a hydrator, and she took her 8 glasses a day seriously. But she was drinking most of them between 4 and 9 in the evening because that was when she felt thirsty. She was eating a diet that was genuinely healthy by most measures, but high in sodium because she relied heavily on tinned goods and pre-made soups for the convenience they offered. And every afternoon, she sat in the same armchair for 3 to 4 hours reading with her feet flat on the floor. I ordered a simple 24-hour urine collection. Her nighttime urine output was 61% of her total daily volume. That number tells a story. She was producing over half of her day's urine while she slept. That is the signature of positional fluid redistribution. We made 3 changes. A sodium ceiling of under 2,300 milligrams per day with a specific list of the foods driving her intake. A hydration schedule that moved 70% of her fluid into the morning and early afternoon. And a simple habit, 40 minutes on her sofa with a pillow under her calves before dinner every evening. Within 2 weeks, Clara was down to 2 nighttime voids. At 6 weeks, she was consistently waking up once near the end of the night, close to her natural wake time. She sent me a handwritten note. She said she had forgotten what it felt like to wake up rested. That is not magic. That is physiology applied correctly. Now, let us talk about what age does to this equation, because it accelerates every part of it. After 60, the walls of the veins in your lower limbs become less elastic. They cannot push fluid back toward the heart as efficiently as they once did, which means more fluid pools in the legs during a given afternoon than it would have 20 years ago. Simultaneously, mild age-related changes in cardiac output mean the circulatory system is slightly less effective at clearing that pooled fluid during normal daytime activity. The vasopressin system, as we discussed, is producing 30% less of the nighttime brake hormone. The kidneys themselves have a slightly reduced overall filtration capacity, not disease, just the natural change of aging, which means they are less able to quickly process a sudden fluid load. Put all of that together, and you understand why a 68-year-old who drinks a glass of water at 9 in the evening and eats a sodium-heavy dinner has a completely different night than a 35-year-old who does exactly the same thing. The problem is not weakness. The problem is that nobody updated the instruction manual. So let me ask you directly, how old are you right now? Write it in the comments because your age changes which part of this equation is most dominant in your situation. The vasopressin decline, the leg vein elasticity, or the fluid distribution pattern. And that is worth knowing. Here is the night relief protocol. 3 steps. Start tonight. Step 1. Establish your cutoff window. Take your target bedtime. Subtract 2.5 hours. Write it down. That is your last fluid intake of the day. Set a phone reminder for 5 minutes before the cutoff so you can take one final small sip if you need it. From that point, nothing goes into the body in liquid form. Not water, not herbal tea, not a sip from your partner's glass, nothing. And if your evenings currently include caffeine or alcohol of any kind, move them before the cutoff, ideally before dinner. Step 2. Front load tomorrow morning. Before coffee, before your phone, drink a full glass of water. Set your phone alarm for 11 a.m. with a note that says 2 glasses by now. If you hit noon having consumed 60 to 70% of your day's fluid, you have done the hardest part. The afternoon becomes a gentle taper, not a catch-up session. Step 3. The afternoon drain. Pick a 30 to 45 minute window in the late afternoon before dinner. Lie on your sofa or bed with a pillow elevating your calves above hip height.